This year, my colleagues and I are introducing legislation to further advance the state's position as a nationwide leader in reproductive health care. We are looking to expand access to health care focusing on fertility, which is another component of reproductive health care that has been overlooked. Although Illinois has many laws to make reproductive health care more accessible, there is a significant gap in coverage for fertility preservation treatment. Under current law, Illinois regulated health insurance plans are only required to provide coverage for medically necessary standard fertility preservation services, making these treatments largely inaccessible because of their high out-of-pocket cost. As a 36-year-old woman, I know many people who are struggling with this, and I'm eager to share a deeply personal perspective that has fueled my commitment to my legislation, Senate Bill 2623. I have witnessed many women, including myself and those close to me, experience profound anxiety about running out of time to start a family. I've had heavy conversations expressing our dreams of having a family while facing financial barriers that limit our ability to preserve our fertility. My friends and loved ones have had to decide between paying off their student loans or even going into debt to afford fertility preservation treatments to ensure that they will have a chance to have a family in the future. Without insurance coverage, they will have to foot the bill of the procedure, which can be as high as $15,000. People should not have to incur these radically high costs when making choices about their reproductive health care, especially as those costs disproportionately impact women. This bill is not just about politics and paperwork. It's a response to my own late-night chats filled with dreams and worries. It's a response to the stories and fears of so many people experiencing the very real struggle of envisioning a family amid financial constraints. Having the option to have a family later in life, especially when people with uteruses have felt like we have limited time, is life-changing. I look forward to highlighting the personal stories that underscore the importance of this bill when working with my colleagues and stakeholders on this legislation. This legislation will ensure that every person, regardless of their circumstances, has the ability to pursue their dreams of starting a family. And I cannot wait to continue to advocate to pass this spring.
Infertility treatment is notoriously expensive, and many women in Illinois struggle to afford the care needed to diagnose and treat it. I was actually one of those people. I have, it's not in the cards for me, but it became a very expensive process for my husband and I. And I am not alone. There are many women, professional women, women of color who've experienced infertility. And it is a very uncomfortable conversation, but I'm happy to have it. I want to share my experiences going through this process because I want others to learn they're not alone. And so when I learned about the difficulties of coverage, for the difficulties if you do go through this process and you want to store your embryos, it is a very costly and expensive process, of course. My legislation requires entities with more than 25 employees to provide coverage for the diagnosis and treatment of infertility in women. It also requires them to cover injectable medications this is a little side to the bill, that improves glucose levels and weight loss for those diagnosed with prediabetes, gestational diabetes, and obesity. Diagnosing and treating infertility is an important aspect of reproductive health care that is often overlooked. Whether it is IVF, embryo transfer, or another type of treatment, it can be very difficult to access these treatments without a diagnosis, even for people who receive a physician's recommendation for treatment. My plan also tackles the cost of glucose management medication to ensure we're addressing some of the biggest cost-prohibitive treatments in Illinois patients need, but often can't afford. My hope by removing these financial barriers to treatments for diabetes, obesity, and infertility will help men and women across Illinois live healthier lives.
Fertility treatments is something near and dear to my heart. Nothing is more of a blessing than having a child. I'll just tell you that right now. My daughter, Maddie, is so special to me. When you watch her dance class, you see her smile, you see her dance moves that she does. That wouldn't have been possible without in vitro fertilization and going through that procedure. We had a constituent of ours who I hold very near and dear to my heart, a special woman in our community who takes care of a lot of people. There's a process for when you go through IVF. You have to go to a doctor for them to give you the necessary permissions, I guess you can call it, to get IVF treatment. But there's steps before that. Sometimes, though, based on your age, based on timing, based on other medical concerns, a doctor may recommend you go directly into in vitro fertilization. We had insurance, this constituent of ours, she had a meeting with her doctor, and her doctor said, you know what, you are supposed to go right to IVF. But the insurance company says, no. Who is an insurance company to tell a middle-aged woman who wants to have a child that you can't go directly to the treatment? Is it because of cost? Is it because of policy? Is it because of something else? They should listen to the doctor, especially when it comes to that. And that's why it's problematic for me, and that's why I brought this piece of legislation. It's for those insurance companies who think they know what's best for someone else's family planning. It's not right. And this bill, our bill and our package together here, will help women and families across Illinois and hopefully set an example for other states to follow.
Thanks for watching this video. Please like and subscribe to keep up to date with news from the caucus. For more information on what the senator is working on, you can follow them on social media using the links in the description below.